physics.
Hello everyone, welcome. We're still waiting for others to join. We're still waiting for others to join. Good. Hello, Heavy D. Welcome. Hello, Olusegun. Welcome. Thank you for joining. You're welcome. Thank you for joining. Yeah, so today we're going to be asking questions. Hello, it's so good to see you here, so good to have you. Thank you for joining, Heavy D. Okay, so let's just wait for a few more people to join us. And today we are having a guest gynecologist who will be joining us. We're having a guest gynecologist who will be joining us to answer all the questions that we need to be answered. Were you able to fill in the form? If you were not able, I'm just taking a look at some of the things that some people asked, because we're getting ready to ask and answer questions pertaining to feminine health issues. Yes, his name is Dr. Olusegun Ilesomi, and he'll be joining us shortly. Hello, praying parents, Pastor Lade. Thank you for joining the live session. I appreciate you joining us. Thank you. Thank you so much for joining. Okay. We had a bit of network issue. Can you hear me? If you can hear me, please leave it in the chat, the comment section. Let me know. You're welcome. Hello everyone. Thank you for joining. If you can hear me, please leave. Yes, you can. Absolutely. Oh, welcome, Iron Fair. It's so good to have you here. Thank you so much for joining. Thank you. So I'm still waiting for our guest speaker to, as soon as I find him, I'll just add him up and then we'll go right into it. Welcome. Woo! You're welcome. Okay, so right off I'll be introducing our hosts, the visionary of what we're doing here at the Feminine Health and Fibrous Support Network. This is a community. Yes, you're welcome. So, thank you so much, Dr. Ilesomi. It's so good to have you here. This is the community of women. This is a community created basically for hand-holding women who's on a journey, either treating fibroid or other related health issues, and it's born out of the need and desire to help, to give hope, to give answers, to give encouragement and support to women going through situations such as this. So you're welcome. We're so honored to have you. I would ask our guest speaker to please request to join so that I can add you up. I will get right to it. Okay. Hi, Dr. Olusegun Ilesomi. Please, can you join? Can you request to be added to this live video so that we can add you? Hello. Can you hear me? Can you hear me, Doctor? You'd see a button on your screen that says request to join so that I would add you up. Wow. Hi, Ruth. Thank you for joining. Yes. How to request, please? Okay. Hi, Sin. So I have just invited you to join. Okay. Ooh, wonderful. Hello, Dr. Ilesomi. Nice to finally meet you. Hello.
Can you hear me?
Loud and clear. Can you hear me?
Okay.
I
can. I've been struggling with the with the technology initially.
Right. I know that happens sometimes. You're welcome. You're
Yeah, that's
welcome.
fine.
So can we meet Dr. Ilesomi in a few, just tell us about you and what you've been doing, especially in the area of feminine health.
Okay. Thank you very much, everybody. Good evening. My name is Segun. My full name is Olusegun Ilesomi. I'm a consultant obstetrician gynecologist. I trained in Nigeria, in Lagos University Teaching Hospital, and I trained from between 2006 to 2011. I've been living in the UK since 2012, and I currently work as a consultant here in the UK in the same field. My interest, obviously, is in obstetrics and gynecology. I've done a lot of, I'll say, both back in Nigeria, and particularly with relationship to this topic, I would say my day-to-day work has been in the field of taking care of ladies with uterine fibroids and also just managing them right up until they try to have babies as well. I've trained other people also as well in managing women with uterine fibroids, and I've also carried that over to here in the UK where I try to impart some knowledge to colleagues here because it's not as common here as it is in Nigeria. So that would be sort of my main, should I say, work life so far with regards uterine fibroids.
Interesting profile you got there, Dr. Ilesomi. It said that between 20 to 80% of women, between 80 to 20% of women of African and Asian descent or background would be diagnosed with fibroid before the age of 50. How true is this in your experience?
Yeah, that's a wide range that you actually let us know, which probably reflects what we see in real life. You've said between 20 to 80%. Indeed, some books back then when I was studying in Nigeria would let us know that if you were to check through women, unfortunately, we would talk about medical students. We usually would learn off of cadavers, and they would say 9 out of 10 of those cadaveric specimens would have fibroids in the uterus
Wow.
that we see. So we're talking about it's as common as 9 out of 10. So women across the world, not only in Africa, would have uterine fibroids. It's the important thing with uterine fibroids is how it affects everyday life and how it affects women when they come to try for fertility. So it's
That's
common.
it. That is really that, yeah, it's really that fertility angle. Okay, so I have a few
Uh,
questions here. I would
yep.
ask questions and then we'll take it from there. We'll just have a natural conversation based
Yeah,
on
yeah,
the
yeah. We can
questions
do it
that
that
we've
way.
we've seen here. Yeah. So the
Mm,
first question is the first person says, what can be done to manage excess bleeding during periods when fibroid has
mm,
been newly diagnosed, or when a person has been newly diagnosed with fibroid? What
mm.
or how can we manage that heavy excessive bleeding? And for some women, it can really be it can really be women lose blood, they will have to take, sometimes you would even have to go for blood transfusion. It can be that bad. So how can you
Yeah.
manage this excess bleeding?
So the first things first is to just explain. Sorry, just shut that there. The first things first is to just explain that you see with the uterine fibroids, thankfully we've got a wide range of women. So I've talked about some studies saying you can have fibroids in about 8 or 9 women out of every
Mm,
10. So
mm,
that's quite 80 to 90%.
mm.
Still, people can have fibroids and be asymptomatic, so have no symptoms at all, no problems
Wow.
at all.
Like
So they have
benign.
fibroids. Well, it's fibroid is always benign. That's the important thing to note. But I'll come to that in a little bit.
Okay.
So women can have fibroids but not have any symptoms. So while some women unfortunately can have fibroids and have symptoms, it would have been easier if it was, oh, if you have so size of fibroids, it equals to you will have symptoms. Unfortunately, it's not that easy. Some women will have very few fibroids scattered here and there, but have a lot of symptoms, while some women will have large fibroids and more or
Mm.
less have no symptom at all.
Wow.
In terms of the heavy bleeding you've just discussed, now that can be one of the pointers that lets a doctor or your gynecologist start to examine to see what's
Mm,
happening with the woman for you to find out that the person, for example, has fibroids as a cause of the bleeding. Now, there can
mm,
be other causes of having heavy menstrual bleeding, but if we
mm-hmm,
focus on fibroids, when the doctor finds out you've got uterine fibroids and links that to the cause of heavy bleeding, the
mm,
discussion needs to be around how old is the woman. If the lady, for example, is already 50, 51 years old, about to go through the menopause, the discussion can be had as to should we give you medication that just tides you over until the menopause? And once you've gone through the menopause, you're no longer having monthly bleeds, then it doesn't become a source of worry for you, even though you know
mm,
you have the fibroids in the womb.
mm,
The other option would be if we look at ladies that might be between ages, let's just pick age out of the air, say
mm,
between ages 18 to 42,
mm,
which would
mm-hmm.
be like the ages where women will be looking to fall
Have
pregnant, at least
children.
naturally.
Yeah.
You would look at those ages, and
Mm,
the only thing that curtails your doctor might be if the person is looking to fall pregnant in the sort of
mm,
first year or
mm,
two following treatment.
mm,
Now, one of the first things doctors like to offer is they want to offer you something that sort of helps to slow down the bleeding if you're in the reproductive age group or if you're in the age where you're seeking for fertility. They would want to give you, I think I saw it in the group, something known as Ponstan, or the trade name is tranexamic acid. They will give you these tablets, maybe between 500 milligrams to 1 gram. That's two 500 milligram tablets. They will ask you to take it 3 times a day, and they will ask you to take it from the first day of your bleeding. So if you were to have bleeding today, you take it for the next 4 days, 3 times a day, every 4 days, and then you stop. The hope
Wow.
is that it helps to reduce the amount of bleeding that you have in that sort of bleeding cycle. That would be something we would offer ladies when we're looking to preserve fertility, because it's like a painkiller. It's like you taking paracetamol, for example. It doesn't affect you getting pregnant, but it reduces the monthly bleeding. Do you see?
Okay. Yeah.
The other option would be we would combine that with mefenamic acid, which you would give women to help to reduce pain that might be associated with the bleeding, or associated with just the fibroids in general, which ladies will use around that time. Taking both these medications, you can still fall pregnant and it doesn't affect your fertility. There will be other management options, which unfortunately, many management options you offer ladies to treat heavy bleeding or treat bleeding disorders, let's say, it unfortunately has to affect fertility.
Wow.
Now, whilst in this age range, you might find the people that have completed their family and are just looking for treatment for the heavy bleeding. The sort of first go-to medication that is quite effective will be for you to consider, will be for you to, someone has their volume up.
Hi.
Uh, Hi, Tony. So the
Please
one
go
of the
ahead.
first things will be for, yep, one of the first things will be for you to consider using the Marina coil. This is like an intrauterine contraceptive device
Okay.
that has the progestogen impregnated within it, and
Okay.
this would slowly release the progestogen into the lining of the womb till sorry, it's just a bit noisy just now.
From
Sorry, yeah, a bit noisy. I think is that Toyin that it's a bit noisy.
yeah,
Yeah, I'll come
her
off.
background. Okay.
I'll come off.
Okay. Okay. Please go right
Um,
ahead, doctor.
so
Yeah, continue, please.
so okay, so the Mirena coil, it's known Mirena, the Mirena coil.
Myrina.
I know it's quite expensive, especially if you're looking to pay for it yourself. It's just it's so effective. Some studies here in the UK show that we actually get anywhere between 7 or 8 women out of 10 women that would have come to the clinic with heavy menstrual bleeding, not
Wow.
needing to come, not needing
Wow.
to come if they use the medication, if they use the Mirena coil.
Coil.
It needs you to go to your doctor to insert it. It can be easily inserted, but the doctor just needs to take extra care to just make sure they navigate into the womb properly to deposit the coil in there. The coil can stay in there for 5 years. It keeps releasing the hormonal agent gently into the lining of the womb and keeps the lining of the womb nice and thin. If the lining of the womb is nice and thin, then it keeps the bleeding away. Okay.
Wow. This sounds
Sorry,
like sort of. Can you hear me?
I can hear you. I'm just still getting a bit of background.
Sorry about
I know
that.
my own children aren't around.
I set them away. I just don't know how. But let's just continue our conversation. I'm
Yeah, carry
enjoying
on.
it
Yes.
thoroughly. So, there is something that you mentioned, the Myrina coil. Is that the correct
Mm,
pronunciation?
yes, that's the
Okay.
correct
It sounds
pronunciation.
it sounds a lot like IUD.
It is IUD.
Does
It
it
is IUD.
function similarly?
Yes, it does.
Right.
So, I started off the conversation by saying that the first sort of two things I was explaining will be the ones you can use while still trying to fall pregnant.
Yeah. Yeah.
Nearly
That's
every
the one
type
you
of treatment,
ingest. Yes.
yes, nearly every other type of treatment actually, unfortunately, stops you getting pregnant.
Prevents
So
you,
you've
you
got
know.
the Marina coil, which some people put it in as part of their contraceptive efforts. So they
Yeah,
use it for contraception.
as
It has
well
the added
as.
advantage that they don't get any periods at all for that 5 years while they have it. It's not unsafe because the medication is keeping the lining of the womb nice and thin, and that is what a menstrual period does to your lining of the womb. It refreshes it every month by keeping it nice and thin. There
Fantastic.
can be combined oral contraceptive pills, which can be used, which unfortunately, same thing too, you can't fall pregnant with that. The other thing you can also use would be progestogen only pills. There can be injections, but all these different devices and medications mean that one can't fall pregnant well once you go on those treatments. Okay?
Wow. Okay, I'd like to ask a personal question. When I was
Yes,
pregnant for
let's
my
go.
first child, I had fibroid,
Yes, ma'am.
and it
Yes,
was
ma'am.
it was horrible. It was painful.
Yes,
It
yes,
was and everything in between. So I'd like to ask.
yes.
I'd like to ask.
Mm-hmm.
Yeah, I this was before I was first diagnosed of fibroid when I was 22. I was
Yes.
22 when I was first diagnosed with fibroids. And 5 years
Mm,
later, I was ready to have my first child. And I had
mm,
severe pain and all that. So how do you suggest, or how would you suggest a pregnant woman dealing with fibroid, uterine fibroid? I had so many threatened abortion, for
mm,
that particular pregnancy. How would you
mm,
advise a pregnant? Because you cannot take some of these pain relievers. I'm not sure you can take them while pregnant. How
mm,
can you
mm.
how
So,
can a pregnant woman manage the effects of fibroid whilst
mm.
still carrying her baby?
So, the thing with fibroids and pregnancies, on the one hand, if we start off, on the one hand, the fact that there's fibroids, some women struggle to get pregnant.
Yeah,
Some women, when they get pregnant, because of the fibroids, they have a miscarriage.
yeah.
While some women still, whilst pregnant, they just suffer through um, pain in pregnancy because of the fibroids. Some other women with the fibroids and pregnancy have no problems at all. Now, that is the majority of women. The majority of women will have fibroids, fall pregnant, will not even realize they have fibroids until they have a scan just to check their babies, and people will mention about the fibroids. They might
Oh,
come for another scan, and it might be difficult to find the fibroid because it flattens out or softens. It softens in pregnancy and it flattens out, and you might not struggle to even see it. Unfortunately, there are some women that have pain with their fibroids in pregnancy. In such women, what would happen is the fibroid undergoes something known as a red degeneration. So it gets a bit softer, it starts to flatten out a bit, but it becomes quite painful. And women need to use simple pain relief. So they start off using paracetamol. They might need to progress to something like codeine even. But usually it's
wow,
just pain management. It's just pain management. You can't really do much else but pain management. Thankfully,
wow,
the red degeneration does not usually lead to like a miscarriage event or a preterm labor or anything like that. But it needs careful management because it can be excruciatingly painful, and
excruciating.
it's not unusual that women are admitted into hospital for
Yeah.
pain control when they have such.
I can relate. I can relate thoroughly,
Well,
and I
thank you for
also
that. Thank you so much for that. Really appreciate it. And apologies that I'm late. It was just a lot of technical issues. But I love your question that I've been kind of been in my mind recently, and a lot of people have been asking me, and I actually had to speak to a friend recently, is around young
Mm,
teenagers, and fibroids. It's possible that teenagers can have fibroids, and I
mm,
mean, what will be the cost? Because I do have someone who's close to me, who's young, 14-year-old. We go to school 3 months on, and they can't seem to know what the problem
mm.
is. So can teenagers have fibroids? Yeah, this one.
Important thing is with uterine fibroids, people like to know, oh, what causes this? What caused that? Unfortunately, there is no cause known. Nobody can tell you 100% that this is the cause of fibroids. If it was something that was easily known or we knew the cause, then you would find efforts being directed at trying to tackle that. Unfortunately, we don't know. And because we don't know, you find that we almost wait until women or ladies present with symptoms of the uterine fibroids itself. And that's really when you start to tackle it. A teenager, so a teenager, I'm going to use, age 13, for example, to 8 to 19. Um, if we were able to just make sure in and they start finding it heavy. Now, the strict definition of heavy period is actually what the woman herself is describing as. It doesn't necessarily, of course, the doctors might have definitions for when it's going beyond 8 days, when it's soaking through pads, when it's staining underwear. But really, a woman describing her period as heavy should be something that the doctors should take on board and treat it as such. So the teenagers would need to go in. These days, they are usually adolescent gynecologists and they
Okay.
are pediatric gynecologists who can see children. Because, of course, the teenager will start from child right up until they cross 18 before you would say they are adults. And you would usually be able to find a cause for this heavy bleeding. It's usually quite simple treatment as well. I do appreciate that it might not be something that back in when I was in Nigeria, it would not be something we were happy to allow teenagers to start on, but it can be quite easily solved by starting the teenagers on combined oral contraceptive pills. It just regulates their periods. It gives them a more, should I say, a better experience of having periods. It's not heavy, it's not painful. And when they come off it's not unusual that when they come off the pills, 6 months, 3 to 6 months later, that their cycle has regularized. So it's not usually uterine fibroids that is the cause. It's
Okay.
usually some sort of dysfunctional bleeding as a result of them starting periods.
Right.
Interesting.
Right. Thank you for that.
Yeah.
That's really enlightening. Because I mean, part of the things that we want to do um, in this hub, in this mission, is create early awareness, especially in young people. Some
Mm,
of the things that I know
mm,
now, if I knew these things when I was much younger, I'll have managed situation better. I would have done things differently, and I
mm,
probably wouldn't end up where I'm at today. So it's kind of educating our girls, our young girls early, so they know how to look out for themselves. They know what to look out for, because fibroid is a black woman's thing majorly, and so that way,
Yeah.
especially if it's hereditary, if you know your mom's gone through it, and then it's likely that you might go through it. Yeah, prayer aside, all of those things, but honestly, there's common sense. There's a place of prayer and there's a place of common sense, knowing what to do and educating yourself to take actions along that line. So part of the things that we want to also kind of propagate is just educating our young girls early, so they know how to look after themselves.
Yep.
Yeah. So, doctor, I'd like to ask a question. Someone else asked, is there any connection between belly bloating and fibroid?
Well, because of how serious it can be for someone having a bloated abdomen, I'll address that first. There will be a certain age of women that would have that would present to you and say, "Oh, I'm always bloated." Now I'm talking about easily above age 45 and tending towards, the ladies that are up to 70s. So if I paint a picture of for example, a 65, 70-year-old lady coming to me telling me she's got bloated abdomen, it's important that I make sure that we ask her to get scans done, just so that we can make sure that she does not have any problems with her ovaries. So because abdominal bloating can be one of the signs of ovarian cancer. Now, someone might be thinking the belly bloating that they are describing, they might be wanting to describe the tummy, the cosmetic look of how the tummy appears, should we say, pregnant, because they've got the uterine fibroids. Now, that's different. That would be the cosmetic look. It's not necessarily bloating. It's not necessarily like their tummy just does not, it just seems like big, round, and distended. In this particular situation, it might be because the fibroid itself is quite enlarged. And if the doctors would usually measure the fibroids in pregnancy sizes. So if they were to write in your hospital notes, they'll write like 16 weeks size. So that's the size of your womb corresponds to a 16 weeks pregnancy. Or they might write 32 weeks, which of course I've seen many times in Nigeria, where the fibroid can be as big as, or the womb itself becomes as big as like a 7-8 month old pregnancy. So that might be the cause for some women that you eventually find have fibroids and have huge fibroids. That will be one of the biggest causes of the belly bloating. There are other causes of course, people having bloating, ranging from being lactose intolerant to eating foods that can be gassy and things like that. But if you're not finding it in the course of your investigation that there's any clear linkage to something gynecological, then it's usually something to do with your bowels. So it will be something to do with your intestines. So it can be irritable bowel syndrome, inflammatory bowel disease, that sort of thing. So the two are not always linked, except it can be quite an important sign to pick up for older ladies, because it can be a sign of ovarian cancer.
Wow.
Awesome. Amazing. Thank you for that. Another question that's come up is around fibroids and pregnancy. There's a myth around if you have fibroids, and then when you have children, they either tend to go away or they get smaller. Is that true at all?
Yeah, I already was saying this. It's not unusual that when women are pregnant, they already know they've got fibroids. So when they are pregnant, they might be inquisitive to ask, "Oh, you're doing this scan for my baby. I know I've got this fibroid. They told me I've got 3 centimeter fibroids here and here. Where are they?" The person doing your scan might tell you that they can just barely see it. It's not unusual that when you're pregnant, the fibroid softens and flattens out. So it might be difficult to see. It's not as if it's gone away. It's just there until the womb comes back to its normal sort of shape. Because if you make a fist, that's the approximate size of your womb. Just that the fist, when you make a fist with your hand. Now, when you have a baby, you should look at your baby, think of the size of a baby, how big the womb itself becomes, and how stretched out. So So that's what happens with the fibroids. It
Right.
seems to disappear, and when people are pregnant, but it's not as if it's gone,
So it's still
and
there?
it's not as if so it is still there. It's just you might just not be able to see it on the scan. There are some fibroids that are so big and so rigid that even when you're pregnant, they don't soften appreciably enough that you can't see it anymore. And several times I've examined pregnant women and still been able to palpate or to feel the fibroids through the womb still. Yeah.
So when the fibroid flattens out and all, and you have the baby, is there any time or point in the woman's life that it becomes a problem? That
Like I said,
flattened out fibroid becomes a problem?
no, you see, the flattening out is uh, think of it like a rubber band. Yeah.
Mm-hmm.
If you think of a rubber band, you can stretch a rubber band to sort of hold something quite large, but the
Yeah.
rubber band is that tiny. Now, if you remove that large thing that you stretch the rubber band round, the rubber band becomes the small rubber band again.
Mm.
Does that make sense? So if you stretch out the womb, it is not unusual that it causes it some difficulty for the person doing the scan to see the fibroids. And it's not as if
Wow.
it's not there. If previously felt it yourself, just the fact that you now have a baby growing in the womb itself stretching out, it's not unusual that you don't feel it anymore. Now, as soon as the baby is delivered and the womb starts going back to its former size, then that soft rubber band that's stretched out
Comes
now
back
becomes
together.
comes back to its shape, and then you're now better able to feel it. And if you were to have a scan, you're probably able to see it.
Female. Okay.
Wow.
All right.
So,
There's let's go. I just want us to take this question before we
yep.
start to round off. Someone now, this is just a whole lot. She says, I'm 42
Yep.
years old. I've been diagnosed with adenomyosis, fibroid,
Yep.
hypothyroidism, and endometriosis. What are my
Mm.
chances in having another baby? I have two kids. One is 23 years old. I had her while
Mm.
at college. So her
Mm.
husband is not a biological child. So this is more like a
Mm.
family question. My
Mm.
normal birth. Okay, so right now she has a child. My normal birth, while the second is going to be 10 this November. So
Mm.
she has
Mm-hmm.
two children, like 12 years
Mm.
apart, 13 years apart, and she's
Mm.
asking if she can have another child at 42
Mm.
with all of
Mm.
these things that she's been diagnosed with:
Mm.
adenomyosis, fibroid, hyperthyroidism, and endometriosis.
Mm.
What
Well,
chances does she have?
mm. The first thing is, when I was talking about fertility,
Mm,
I said I'm picking numbers out of my hat, right? I
mm,
went 18 to 42 for
yeah,
natural.
yeah.
Um, People can fall pregnant even well after age 42. Most IVF clinics stop at age 42 in terms of offering women the facility to get pregnant. So, in terms of offering women IVF, they stop at age 42. It's really because the quality of eggs that are still left behind, that's in the ovaries, the number of eggs are reduced by that age. The chances of falling pregnant is much reduced compared to age 18 to 22, for example. So, whilst you can never say that person can still fall pregnant, the main health advice will be make sure your hyperthyroidism is under control with medication. Make sure your doctors treating the hyperthyroidism know that you're trying to fall pregnant so that they can offer you folic acid because that's quite essential that you're topped up properly with your folic acid to prevent
Okay,
the baby from having neural tube defects where
okay,
the backbone or the spinal cord does not form properly. It is important that the doctors consider whether they can alter your medications in such a way that you actually have a different form of medication whilst trying to fall pregnant but still controlling the hyperthyroidism.
mm,
If the hyperthyroidism is not well controlled, then actually the person is usually not in the best state of health really to fall pregnant in any case. The
Wow.
fact that the person has had two children before, and indeed another child with the current partner, it bodes well that they could actually still achieve a natural fertility. It's important to know that at age 42, it is going to be quite difficult compared to age 18 to 22, for example.
And
Amazing.
then, and the
And then with
endometriosis.
the adenomyosis and the endometriosis, you see, on their own, they don't stop people falling pregnant. If you found someone who's been struggling to fall pregnant, has not been able to conceive at all, then those start to take on more significance. You start to wonder whether the endometriosis, for example, has caused scarring inside the abdomen. That means it's blocked the tubes. You wonder whether the adenomyosis is causing such heavy menstrual bleeding that the person is actually not engaging in regular unprotected sexual intercourse enough to fall pregnant. So these would be things that you would start to look at in more detail when you encounter someone who's never fallen pregnant before. But if the person has fallen pregnant before, if the person isn't having symptoms that directly, stop the person trying for a baby, then on its own, the hyperthyroidism becomes the most important list, should I say, symptom or illness amongst the list of things you've just mentioned.
Wow.
Amazing. Thank you so much, Doc. Really
Mm,
appreciate your time. And thank you, everyone. Our time's been fast spent. We do appreciate you joining us today. And on this platform, in this network, our goal is really to just create an environment to educate women, and support, empower, nurture people, address some of the conscious and unconscious biases. Because honestly, on my journey, some of the things that I've had to endure is because of the things that women have been told, though, it's okay, you just handle it, get on with it, it's not that
mm,
bad,
mm,
those kind of things. And women just um, live with things that are not unnecessary, and they end up in a bad situation, and honestly, educating women, helping women speak up, honestly, is really important. And those are some of the things. It was amazing after I had to go through a procedure, and I began to find out that a lot of people have gone through that. And I was wondering, why is no one talking? Why is everyone quiet? If everyone's doing this, why are we not helping the next people? Why are we, the next generation, are we not talking about this enough for them to, be able to get some education and know how to help themselves? So this is what our goal is. And we want to bring more people, to just enlighten us. We'll move from fiber to the next, and depending on the hub, we have a hub of about 80 something people, women currently, and some men, who love them, who are part of the hub. But our goal is just to just educate women, create a support network. Those are some of the gaps that we found out that it's not there. No one's trying to, hold other woman's hand to go through, because it's a lonely journey. And if
mm,
there are over, I don't know how many million of women are saying it's a lonely journey. Why is it lonely if all of you are going through the same thing? We can all come together,
mm, mm,
and say, okay, this is how I felt. And then you don't know what you're going to say that helps the next woman, and then the next woman, and your experience can, make another woman feel a little bit better and not have to go through the whole rigmarole of what you've had to go through and endured. So this is what
mm,
we're all about. And I really, really appreciate your support, Dr. Shegs. Thank you for
mm.
coming. I know you will be back again.
Yeah.
I know you'll be back again somehow. By bullying, by
No
harassment,
problem.
somehow I know you will be back.
No problem. I'll be pleased to come back.
Thank
Thank
you.
you.
Thank you
Thank you
so
so
much.
much.
Really do appreciate your time.
Mm.
Thank you very much. And then Mavi, go on then.
Thank
You want
you.
to tell
Thank
people
you.
about, yeah. Thank you, bro.
Yeah,
We've used a
so
lot of
let me
time.
just
We just want to
let me
open our
just
Yep.
programs
run
now.
through a short presentation like message who we are. Like Ms. Toyin has
Yes.
already said, we're
Thank you.
a group of
Yep. Yep. We're
people,
good.
a support group. Our job our passion, the heartbeat is to provide support, provide encouragement, hold your hands through the journey, organize programs like this, and let other people know what your choices are, know what adjustment to make, know what lifestyle changes to make. You don't have to go this journey alone. And that's why this platform has been created, to help people, not have to go through these unpleasant experiences. I endured a lot of unpleasant situations, pain, and people preaching at me, telling me to be strong, hold on to the Lord. I know we have to hold on to the Lord, but can someone tell me what is going on, please? I was barely an adult. I was just 22 when I was told that I had fibroid, and the person who even diagnosed me said, if I didn't get married on time, I'll never have children. Imagine telling that to a 22-year-old.
That's
you
poor.
know,
Very poor.
so very poor. So we have bi-monthly meetings over Zoom, and then we have this kind of programs. We have offices in United Kingdom for now and Nigeria.
Good.
Yes. So we would like, if you're on this call and you are not on our WhatsApp group yet, please, at the end of this live session, follow this page for more information. Then go to the link in our bio. Click the link in our bio so you'll join our support group. And on the 18th of September, which is barely a month from now, or less, 3 weeks from now, we'll be having our official launch. So the hub will be officially launched, and all the information and everything that we have been cooking all along will just boom in your face. So we have a registration link also in our bio. Please click the link in our bio, register and be there. Save the date, register. It's 18th of September, 11 a.m. to 1 p.m. Nigerian time. So you just convert that to your time zone and get ready and be there. Thank you so much. Thank you so much, Dr. Ilesami. I've thoroughly enjoyed every aspect of your conversation. You're so knowledgeable and confidently so. Thank you. And
thank you.
And I would like to have you here again. I hope you'll be here again, possibly before the launch. Okay. Thank you, and have an amazing. Thank you, everyone, for joining. Thank you, Salakod. Thank you, Tolu Lokbe. Thank you, Ayon Fellow. Thank you, Chim Jokim. And thank you, everyone. We love you. We honor you. We are grateful that you're here. God bless you, and see you.
Thanks for joining. Have a good evening.
Thank you.
God bless you, darling.
Thank you.
Bye.
Bye.